Hey, everybody. Welcome back. It's Dr. Jack.
And Mary.
And this is the Forbidden Doctor Podcast, episode 130. What's worse, the flu or the vaccine, part 2.
As we mentioned in the last podcast, this is a replay of the second part of a podcast we did on the flu 1 year ago.
And as we are coming into the flu season, we are always requested to give a podcast on the flu. Since there are so many new subscribers this year alone, we're presenting a replay of our podcast a year ago because there really is nothing new.
Yeah, but with the recent announcement by the CDC that the flu vaccine will not help you in the presence of a flu epidemic, we're now even more resolute against getting vaccines for ourselves than we were last year. Both Jack and I would rather be sick with the flu for 2 weeks than be injected with all those chemicals, not the least of which is mercury.
Oh, yeah.
Yeah, the flu shot still contains mercury. I would rather have an infectious problem for a couple of weeks and lay there and moan and groan and get all kinds of attention and even throw up and have the aches and pains than have a chronic problem for life.
And it's that chronic thing we're talking about because we are trading infectious diseases that plagued us decades ago for the chronic diseases today because of the buildup of all those chemical adjuvants that are in the vaccines. We even have some podcasts on this subject. So sit back and relax and just be easy about this. We know this subject is controversial.
But that's what the Forbidden Doctor is, giving you information they don't want you to know. This website podcast is not intended to be a diversion away from the current system of disease management. It is our intention to offer a rational and very effective approach to aiding your body in its ability to rebuild and heal. Please be advised that any suggested nutritional advice or dietary advice is not intended as a primary treatment or a therapy for any disease or particular bodily symptom. Nutritional counseling, supplement vitamin recommendations, nutritional advice, and the adjunctive schedule of nutrition is provided solely to upgrade the quality of foods in the patient's diet in order to supply good nutrition supporting the physiological and biomechanical processes of the human body. Okay, we have a slide here for those of you that are on the webinar, and it's Dilbert. And we want to give credit to Scott Adams for writing this cute little cartoon. And it's Dilbert, and he's sitting there talking to his sometimes girlfriend. She's standing there with a glass of wine. I guess they're on a date. And he said, I couldn't find any evidence that I have a soul, so I built an artificial one and put it in a drone. When my physical body dies, the drone will upload my memories and personality to the cloud to live forever. And then she says, your soul will be trapped in a server? And he said, no, I wrapped it in a virus so I can travel.
We'll be talking about viruses. Of course, he's talking about a computer virus that travels. Once it gets started, it can be worldwide in a matter of hours. His soul could be worldwide in a matter of hours, but so can a virus, and that's what we're going to talk about.
A real virus.
A real virus.
Yeah, biological virus.
Yes.
Last week, we talked about medicine's best advice for the flu, the influenzas. We talked about influenza A, B, and C, and it's how to strengthen yourself. But this is medicine's best advice is wash your hands, wash your hands, wash your hands. That's all they say to avoid the flu and to get the flu shot. We gave a recommendation of last week of a protocol, and it was the cold and flu protocol, which you can find on our website. You just go into our website and search cold and flu or cold, either one, and it will come up with this incredible website or incredible protocol. 3 different ways to fight a flu and to prevent cold or flu, or the first signs of a cold or flu, what to do. And if the cold or flu persists, then add in these other protocols. So I recommend you going there.
So let's start here. Is the flu going to kill me? Some people are going to feel like that when they get the flu. We know it's miserable, but you got to think about the miracle that's going on inside this guy's body right here. And for those of you just listening, he doesn't look too comfortable.
No, but we're going to help you out so you can get over this flu faster and tell you what's inside of the flu shot if you decide to follow the government's recommendation of washing your hands and getting the flu shot.
At this time of the year, being November and the initiation of flu season, cold and flu season, you can't turn a corner anywhere without seeing some sign saying flu shots.
Yeah.
Flu shot here, flu shot there, just like you would see some regular chain convenience store that is all over the place. And this may give you the idea that just going in and getting a flu shot might be just like going in and buying a pair of replacement shoelaces for your shoes. Well, how dangerous is the flu shot? That's what we want to talk about. There are dangerous toxins. There are mutagens, which are substances that can cause genetic mutation, and carcinogens, which of course cause cancer in vaccines. These chemicals may or may not be dangerous in small amounts, but tests prove the accumulative effects of these toxins have never been done.
Yeah. Tests to prove the accumulative effects have never been done.
And because of that, what's important to understand is that these things are not recognized by the body as food. So the body doesn't know what to do with this stuff except to store it. Usually stored, if they're fat soluble, if they're oil-based materials, they're usually stored in fat tissue. If they're not, they're stored in the liver, where the liver's trying to decide what to do. And it's the accumulative effects, of which there are no tests to show that they accumulate. We know otherwise. But as a result, we've had this explosion of autoimmune diseases, Alzheimer's, Parkinson's, and a lot of other nerve degenerative diseases.
But the FDA says the flu vaccines are safe, harmless, and effective.
Well, before we start talking about effective, let's just remember last year's flu vaccine that the CDC came out and said, this one doesn't work, but you get it anyway.
Yeah.
Take it anyway. Vaccines are designated by the FDA. If you don't remember anything else, and I say this every podcast, you don't remember anything else, remember this from this podcast. Vaccines are designated by the FDA as a biological agent, not drugs. This means that vaccines are not subjected to the same level of rigorous testing and safety analysis as drugs are.
Some vaccines have gone straight from the lab to market.
Absolutely.
Without any testing.
You know, they'll test it on some
us.
animals in the lab, but then they put it out in the public, and then they see how the public responds. Your doctor may not realize this, and will assume, as does a large portion of the public, that vaccines as prescribed by the FDA are, as you said, Mary, safe, harmless, and effective. So when the overwhelming evidence is not the case, I mean, if it were, the federal government would not have spent so far to this day over $6 billion to the parents of vaccine-damaged children. A lot of people aren't aware of that, that the government is shelling out money to vaccine-damaged children's parents. Vaccine-damaged in the sense that they're gone. They're still alive, but they're gone.
Well, because they can't sue them. You may not be aware, the federal government has made it impossible to sue vaccine companies for damages. I mean, what other industry in America is so protected by the U.S. government to make it illegal to sue for vaccine damage?
I don't know of any other. You know, and the whole hype came out with the Patriot Act and the Antranex that started showing up. So the pharmaceutical companies lobbied Congress, hey, give us free rein here. Let us put out anything we want.
Well,
we know we're going to
them.
hurt people,
Yeah.
but make it possible for them to not sue us.
Yeah.
And Congress said, what are you talking about? And then what happened? They were held hostage by the pharmaceutical companies. If you don't do this, we'll stop making vaccines and we'll blame it on you.
They said it was too expensive because everybody sued them. Well, why? Why wouldn't it be like antibiotics, which saved the world, you know? Why wouldn't they think this was just absolutely amazing, these vaccines? But they got it passed that they cannot be sued. So what we were going to show you today is the ingredients that are actually inside. We're going to start with this, showing the ingredients that are inside of a flu vaccine.
Because most people think what's inside the flu vaccine, Mary,
is just saline and a dead virus.
And a dead virus.
Yeah.
No, there's nothing in it to hurt you. It's just saline, which is isotonic salt water, salted water of the same salted, concentration as in the body. So there's no real reaction to it. So you get saline and a dead bug.
Well, look what I got off the CDC's website. And this is just the flu vaccine. This is not
These are different vaccines here by different names, and the dates at which they came out. And of course, those of you listening, if you get a chance, sit down with a computer and re-listen to this thing and follow these incredible slides that Mary has put together. I mean, I'm telling you, this is as professional presentation, Mary, as I've ever seen. Here on the left are the names of the various kinds of flu vaccines, in the middle of what's in them and the date that they first came out.
Well, I wanted to make it really simple and really clear. Do you guys realize what is inside these flu vaccines? I mean, this is scary. I mean, we can...
Beta-propiolactone, thimerosal, which of course is half mercury, monobasic sodium phosphate, dibasic sodium phosphate, monobasic potassium phosphate, potassium chloride, calcium chloride, sodium tauronoxacolate, and then neomycin, which of course is an antibiotic, but some of these other egg protein, formaldehyde, polysorbate 80.
Yeah, we're going to go over some of 17 of the most dangerous ones. They even have sugar. They have sucrose.
Well, to make it sweeter.
Why? Oh, maybe that's the nose spray and it needs to be sweeter.
And there's one there that was canine kidneys. Listen, there's something more in there than just
they call these
saline in a bug.
They call these excipients.
Yes.
Or sometimes adjuvants.
Yeah, there's two definitions of an excipient. When you're bottling powder, an excipient is something that would be added to the powder like rice bran that lubricates the entire thing so the machine doesn't, or calcium stearate, things like this. When you're dealing with drugs, an excipient is something, like you said, an adjuvant. An excipient is something that literally neurologically shocks the system to make the system look at something it otherwise wouldn't. Was that too complicated?
No. We're going to explain that in detail here pretty quickly. But there is a website on there I want you to take note of, because I want you to click on that.
And go see for yourself.
Print it out and maybe stand in front of the county health department as people come in. Say, this is my right to show you what is in this.
Yeah.
What is actually
something you might want to consider before
shot.
You do this.
Or stand out in front of Walgreens, for these older people
let's go
that are
through
going
the
in there.
excipients.
Okay, there are 17 hazardous substances in vaccines, including neurotoxins, carcinogens, and mutagens.
Most vaccines contain these 17.
Yeah.
Aluminum phosphate, and aluminum, and then, of course, the next one's aluminum sulfate, and they come in under different names. They do different things, but the primary thing they're designed to do, even though they're extremely carcinogenic and very corrosive, is as a neurotoxin to literally shock the nervous system. I don't know what else to do except to suggest the possibility of taking a butter knife and stick it in a wall socket.
Yeah.
And what will happen to you at that point? That's what happens neurologically inside the system when it comes in contact with either a mercury or aluminum. And while there are more vaccines today that do not have mercury, if they don't, they have a large amount of aluminum, which is, if mercury has a toxicity level of 10, aluminum is there at 9.
Yeah. I'll just give you a little a tip on what's coming. You would not react. Your body would not react to a dead virus.
It runs across dead viruses and dead bacteria
get rid of
every
it.
single day.
It would just go,
and it doesn't pay any attention to it.
Yeah, a little protein.
Yeah.
But if you throw something in that so irritates the immune system that it goes on red alert, it's going to what is going on? And it might recognize the dead or
well, there's some
dead.
other chemicals in a flu vaccine that do the same thing, formaldehyde, which is not only carcinogenic, it's a mutagen that can cause genetic mutations. There's detergents, a water softening agent that has a pH of such a nature as to shock the system. There's thimerosal, which is ethyl mercury. And as we mentioned a moment ago, thimerosal is half mercury, which is the second most toxic element on the earth next to plutonium and is a neurotoxin.
Massive neurotoxin. You skipped past here. The formaldehyde is also, according to the CDC, is extremely carcinogenic to humans.
Yes.
Now, the CDC says that, and they put it right in. Number 6, acetone A. This is a clear volatile liquid used as a solvent for paints and oils, and also as chemicals in plastics and manufacturing.
And a nail polish remover.
Yeah, putting that right in your
That's in
bloodstream.
there. Monosodium glutamate.
Is the next
Why?
one.
Because it's an
MSG.
excitotoxin. It overexcites the brain cells to the point of damage or death, causing brain damage to varying degrees if you can get enough of it. And it's stuck in there. Well, you say, well, what's a
Why would
flavor
MSG
enhancer be doing in a vaccine?
It excites.
To shock the system.
Again, yes.
And then human serum, albumin. Albumin is the form of inactive protein that's going through the bloodstream. But and it's only broken down when it's finally digested. When it's injected, it can cause an autoimmune disorder because you're getting it in such a form that has been mutated into the bloodstream, which is alien to the human system, not the albumin that's in there normally that your body manufactures. We can talk about, I was going to get into allergies, but let's forget about that because this thing's going to be long enough as it is. They use human serum to grow these little bugs in. And then there's benzethonium chloride, another carcinogen, can cause cancer. It's also a mutagen.
Yeah.
No, I want to make sure, you get your money's worth. When you get a vaccine, you want to make sure that you got everything in there you can get in there.
Okay, that was number 9. We still have a few to go. Here's number 10. Monkey kidney cells.
Yes, the monkey cells that carry viruses that can cause cancer and disease. The simian 40. I mean, a lot of people are aware of that.
No, but
From the 1950s, the polio vaccine of the 50s and the 60s had this simian virus 40 in it.
from monkeys.
From monkeys, monkey kidney cells is where they were growing the polio virus. And
They're
there's a lot
blaming.
of people blaming a lot of cancer today on that very thing.
Yeah, and you were of the age where you got that.
Yeah, I got a polio vaccine late 50s, early 60s.
Yeah, and next week we're going to do a podcast on cancer, and we interviewed somebody that has had cancer, and he's an incurable cancer, and he's completely in remission and has been for years and years.
And how he did it.
And how he did it without chemo, without radiation, and he thinks his came from that vaccine.
Also, calf serum baby from a baby cow.
Is in flu
It's the
vaccine.
blood after the red blood cells have been removed. And why? Because they use this serum to grow the viral elements in. And it's also nutritious. And it keeps certain things in the vaccine kicking while they're being stored, while they're being preserved, whatever else. It's a food supply.
Oh.
yeah.
Oh, that's lovely.
Polysorbate 80, it's an antifreeze.
Yeah, it's a bad one.
Yeah, but they use it as an emulsifier and a surfactant. In other words, it breaks down the hardness of the materials that are present because the more stuff you put in a solution, the harder that solution becomes. It emulsifies it, breaks it down, makes it easier for everything to stay in suspension. It can cause infertility, increased risk of stroke, and heart attack.
Oh, just those little things.
Yeah, and then a little bit of ethanol, ethyl alcohol can cause headaches, drowsiness, vomiting, unconsciousness. Again, these things are they're put in there as disinfectants, preservatives that they claim.
Number 14.
Ooh, phenol carbolic acid. Now, there's a good one.
Ooh, I want some phenol carbolic acid in me. It's a corrosive acid listed by the CDC as an extremely hazardous substance in which you should avoid all contact. It can cause dizziness, coughs, headaches, nausea, vomiting, unconsciousness, convulsions, coma, and death.
Yeah.
Least but not last.
These are products that are used in industrial manufacturing, and they're in big 55-gallon tanks, and they got all these poison control symbols and signs all over these containers. But little bits of this is thrown into the vaccine before it's injected into you.
And there's no studies to know if we continually get this flu shot year after year after year, what happens? Does it build up?
They don't have to study it, so they don't.
Yeah.
Glutaraldehyde.
Number
it's a
15.
liquid chemical that's
Oh,
used as a disinfectant. Oh, EDTA.
You skipped.
Yeah, EDTA. It's often used as a chelator.
Oh.
There are doctors out there that do chelation. They do EDTA to do it to clean out the vessels of the body because it increases the absorption of chemicals when it's used in a chelation manner. when it's injected into the body without it being removed back out of the body, which chelation therapy does, and it stays inside, then it allows more chemicals to get across the barriers of the tissues.
Yeah, Dr. McBride, though, really cautions against that chemical chelation.
Yeah.
So I know a lot of kids that have been vaccine damaged do the chemical chelation, and a lot of times they come out worse after. So be really careful with that.
Then the glutaraldehyde that I was talking about is a liquid chemical that's used as a disinfectant, a biocide, actually a hardening agent, a preservative, an embalming agent. And according to the CDC, it can cause asthma, breathing problems, allergies, and coughing. So when you see kids or adults or whatever else that get quite sick after they get a vaccine, you can begin to understand why with the kind of stuff that's in that cocktail. And then the last one we're going to talk about, ammonium sulfate. It's this blue-green powder that's used in chemistry. It's a toxic chemical that can cause drowsiness, nausea, vomiting, difficulty breathing. And again, Mary has included a source for all of this information.
Yeah, there's a website there at the bottom. This last one, number 17, ammonium sulfate, one of the side effects was difficulty breathing, and that's a big side effect of Gardasil.
Yes.
And we had a patient that actually fainted when she got her when she was 12 years old, got her Gardasil vaccine, and her mother kept bringing her back to the doctor saying she can't breathe. She can't breathe.
She can't breathe.
Yeah. So that was cumulative, probably because she was 12. She probably had all her other vaccines. So it was cumulative.
Well, didn't she pass out when she got the shot, the Gardasil?
Yeah,
she fainted right there on the floor.
That's what I was saying. Yeah. But the government says...
The government says they're safe, effective, but these 17 hazardous substances that we've just mentioned are listed on the, quote, Special Health Hazard Substance List and the CDC, National Institute of Occupational Safety and Health, OSHA, their website.
Yeah, I have a typo here. I just noticed. It says, the heading of this says, but the government says these are safe.
I see.
Yeah, the government says these are safe. These 17 substances are safe.
Well, yeah, in a vaccine.
Yeah,
but as an individual thing.
Oh, they're.
See, I think you're okay there.
I think I am. I think that isn't a typo.
Because as an individual thing, they definitely say they're not safe because they're listed on these special lists. But little bitty drops of this and drops of that inside of a vaccine cocktail, they don't seem to have any problem with that.
Yeah, but as a whole, they are listed as not being safe.
Okay, we've got a handout here for you. Do you know what's in a vaccine? None of these belong in your body. It's a handout from learntherisk.org.
Yeah, we don't have this handout. You need to go to learntherisk.org, and there's a list of some other very scary ingredients inside of your vaccine.
Now this smacks right up against the general politically correct statement that vaccines are safe and harmless and effective.
Well, this one says it has latex rubber.
Latex rubber.
Yeah. Then, of course, it's got the mercury and the human animal cells.
Oh, yeah.
Yeah, the phenol, all the
But you
different
can go
things-
there and get
things I
it
can't
for yourself.
pronounce.
Learntherisk.org.
Okay, I want to have a little conversation with you now, and I want to slowly go through this, how vaccine cause chronic immune dysregulation.
Yeah, we're not just talking about vaccines not being safe. We want to tell you what they actually do.
Yeah, and how. And our book that we talked about in the beginning that we have on Amazon, it was inspired by a podcast that this Dr. Thomas Cowan, he's a medical doctor.
At fourfoldhealing.com.
Yeah, he did this incredible podcast where he explained how vaccines destroy your immune system and cause such horrible dysregulation that we have all these neurotoxic diseases popping up everywhere that we'll talk about as we go along. So we humans have at least two immune systems that...
There's a two-pronged approach for the body to deal with some new virus that it comes across.
Yeah, and this is very important to understand. It's really simple. You don't want to get it too complicated here. We're going to really try to simplify these. And there's two systems. One is called the cell-mediated immunity. And this is when you get a virus or a bacteria in your body, this is the immunity system that attacks that virus or bacteria or pathogen. And the second is the humoral immunity, which creates antibodies. So you never get that virus again. Or you never get sick
when you get
that
re-exposed
virus.
to that virus,
Yeah.
right? So they're numbered. We numbered them 1 and 2 because one comes before the other one.
Yeah.
This is the process of getting sick. Cell-mediated means cells mediate the immunity. We have the system of white blood cells that if you get a new invader, like a new virus, and because we've never encountered this before, the virus will infect, which means it's going to get inside the different cells, like a viral respiratory tract, like a really bad upper respiratory cold or flu or something. So if you have infected cells, which the white blood cells go after, and it shoots them up and it spits them out, and in the process you get what we call being sick. And being sick means fever, flu-like symptoms, cough, runny nose, mucus, that stuff. And the important point to remember is that this is really an important point, is that what we call being sick, the fever, the flu, the mucus, cough, rash, headache, etc., is because of our cell-mediated immune system. What we call being sick is a cell-mediated response. It's triggered by the virus or a bacteria or other things, but it's not because of them. We make ourselves sick. Our body, dealing with these viral bacterial invaders, makes us sick for 2 reasons. Number 1, it strengthens the immune response against it, which is one of the reasons why we have a fever. One of the things that really activates the white blood cells is to raise the body temperature. And number 2, we get sick, and molecular compound signaling messages that come out of T cells activate B cells to make antibodies. Now, it's important.
Well, that's the humoral immunity.
That's the humoral part, and that's why it's important to understand the cart comes before the horse.
Yes, this is critical.
So after you get the cell-mediated immune system cleared from that virus, then your humoral immunity,
the number 2,
that's known as the antibody system, remembers what's happened. It's kind of standing back and it's kind of watching what the cell-mediated immunity does. So then it makes antibodies to that virus. And it takes about 4 to 6 weeks, so that if you ever come against that same virus again, you tag the components of that virus before it infects the cells. You clear it before it infects the cells. The cell-mediated immune system never needs to get involved, and so you do not get sick. So you get exposed to chickenpox. You go through cell-mediated immunity, which is going to give you fever, give you a rash, give you
little
the
pox.
Blisters, the little poxy stuff. You put little boxing gloves on your kids so they don't pick them because they'll scar. In a few days, the fever's over, the headache's gone, they don't vomit, they're feeling great, the little blisters go away. But the B cells that are the humoral part that make the antibodies are going, we know who you are, you little devil. And they make these little tiny antibodies that are constantly floating in the bloodstream looking for that virus.
that protect you for life.
And somewhere down the road, you'll run across that smallpox virus again, and immediately the antibody recognizes it, and it does one of 2 things. Either the antibody attacks, because there's different kinds of antibodies, attacks that virus, or it flags that virus so that the cell-mediated system that's on patrol immediately destroys it without it having a chance to build up a population and make you sick like you did the first time. So you could be exposed to that virus a second time and you never know it.
Yeah.
Your immune system took care of it. So you get infected with a virus, then you have a cell-mediated reaction, then you're sick for 2 weeks. Then the humoral immunity kicks in and makes antibodies. So if you ever get that virus again, you'll tag it before it infects your cells, and you'll never even know you got sick again, generally speaking. So that's how the immune system works. There's always both of those aspects, always. We do not know of a disease prior to 1950 that did not follow that system. Number 1, you get sick from the cell-mediated immunity, and it's your body making you sick, not the bug. Your body makes you sick in order to do several things: to alert and activate the immune system, and then to get rid of the
And to
bug.
get rid of it. The
And
diarrhea.
to get rid of it, the diarrhea, the coughing, the
Yep,
vomiting.
sneezing.
And then number 2, the humoral comes in behind it. The antibody formation comes in behind number 1.
So you never get it
Remember
again.
that. So there has never been, until about the 1940s, a situation where you have the stimulation of one of these arms of immunity without the other. But that's what happens with vaccines. The whole point of a vaccine is to stimulate the humoral part, part 2,
Number 2.
alone, without getting sick, and bypassing the natural first prior cell-mediated immunity. I mean, who's going to take their kids to a doctor
And
if
get
the
a flu shot.
if it made them sick? So what they're doing is they're hopscotching over one and going right to number 2. So in order to do that, you have to put irritants, these adjuvants, these excipients we're talking about, into the viral products to make the antibody system react. This is crucial because if you just put in an attenuated chickenpox virus protein, the immune system wouldn't react. You'd just laugh at it. Oh, that's dead. I haven't got time for that stuff.
Yeah.
Give me something tough.
You have to put something in that so irritates the body. You know, mercury, the most toxic substance next to plutonium. So your body just starts screaming, and it will maybe notice those dead or almost dead viruses. And it does work, but it doesn't, because we do titer tests and we can see the antibodies were created.
Oh yeah, that's
But
how they.
it doesn't last
That's
either.
how they can tell that the thing worked, is because antibodies show up. But if I walked into a room of a bunch of coughing, sneezing people, and my robust cell-mediated immunity was strong enough that I might have got a sniffle for a few hours and then it was gone, 2 weeks, 3 weeks later, I'd have antibodies to what I ran into without having to get a vaccine for
Yeah,
it,
the
because my
very
body
latest.
would vaccine me, myself. I would have a vaccine. You know, shouldn't use that word because that's not how it works. But
And
you get the idea.
for life too.
And it's for life.
That's the point I wanted
I
to
wouldn't
bring
need
up.
boosters.
Yeah. So
You have to put
you
mercury
must have mercury and aluminum in the
in the
vaccine.
vaccine to make it recognize this dead bug. And people will say, well, they've taken all the mercury out. Well, in some cases they have, but what did they put in its place?
Aluminum.
Aluminum.
They had to.
It wouldn't work if it didn't have the mercury. So
Yeah.
they take the mercury out and they put aluminum in.
You must have these horrible toxins in there to so irritate the immune system. I don't know how many times
There's
I can
no
say
other
this.
way around it.
There is no other way. But most people think that mercury and aluminum were put in as preservatives.
Yeah. Their use is an adjuvant. An adjuvant means something that's necessary for the body to recognize and make a reaction to it. So what about the people who call for companies to make better, safer vaccines?
Well,
Yeah, there's groups all over this country, petitioning Merck and Pfizer and these other companies that make vaccines, please give us better, safer vaccines. And what happens?
they just drop the mercury and up the aluminum and say we took the mercury out.
Yeah, the whole vaccine is to stimulate antibodies without getting sick. It's to skip the first step in naturally acquired immunization that you and I have already described, because it's not the usual way the body recognizes it. So you're going to have to do something irritating to make that happen. There's no way around it. So when they call for better and safer vaccines, the vaccine people just laugh. I mean, they know that people don't understand what this is about. I recently was discussing this with a pediatrician who's now a patient in our clinic, and I talked to him about finding a pediatrician I can recommend our patients to who is vaccine friendly. In other words, he believes in vaccines, but he believes in people's right to make a choice, and if they don't want them, he doesn't push them into it. Mm-hmm. And I talked a little bit about this stuff, and I realized I was talking to somebody who didn't know what I was talking about.
He didn't understand.
He
And
didn't understand what I was talking
explained it
about.
last week on the podcast when I went in to get an exemption form for our son.
Yeah.
And the doctor, I know he had never heard this ever before.
He's a medical
about
school doctor.
The two arms of the immunity system that create these antibodies naturally. And I might point out that children don't even have the ability to create antibodies until they're 1, sometimes 2 years old.
Yeah, but at least 12 months. That's where it begins, but sometimes it can take up to 2 years.
That's why the Japanese don't vaccinate until
Before
age
2.
2.
Yeah.
So the problem with doing this is that this is just a short list of diseases created by suppressing natural acquired immunity.
Yeah. Where were the kids who had asthma when I was a kid? You know, all through my grade school,
I didn't know anybody.
middle school, high school, I only knew one person who ever had asthma.
I didn't know anybody.
Butch in the 5th grade.
Yeah.
And then there's allergies everywhere you turn. I mean, these kids are loaded with steroids before they're past the 3rd grade to deal with allergies. There's eczema and these skin conditions. And the big C. Mm-hmm. What's the biggest cause now of death of children? What was it, like 11 to 15 or something like that?
I don't know the ages.
But what's the disease?
Cancer.
Cancer, the number one cause of death in children. I think it might be like 8 to 15, something like that. And then we have all the autoimmune diseases that are showing up. There's 80 of them the last time I count that are recognized as an autoimmune disease. 70 years ago, the end of World War II, they didn't even believe that an autoimmune disease existed. They didn't believe the body would attack itself. Now there's over 80 of them. And all of these are characterized by increased antibody production.
Why is our own bodies attacking ourselves?
Yeah.
Why
does our
colitis.
immune system, well, Crohn's, what's it doing? It's attacking the intestinal wall.
colon, yeah.
Colitis, it's attacking the intestinal wall. MS, it's attacking the myelin sheath. Sjogren's, there's several things involved with Sjogren's.
Hashimoto's.
And Hashimoto's.
Everybody
an
has
autoimmune
Graves.
attack against the thyroid itself. All of it. And it's not because, oh, geez, we've just suddenly become aware of the fact that the body has these problems. These things were unknown 70 years ago.
What child was chronically sick in the early 1900s?
Unless there was some kid in some downtown poverty section of some big inner city
Chronically.
that had horrible nutrition so that they were constantly tubercular. That's about the only ones. Very few.
Yeah.
So how did we go from basically having no chronically sick kids to cancer now being the number one cause of death of children?
This is what happens with excessive antibody I can't say it. Antibody production.
Yeah.
So we have tons of antibodies in our body now running around because we're getting shot up with all these vaccinations, and they're just suddenly attacking our bodies.
And the one thing that is consistent with all of these autoimmune problems, they are characterized by excessive antibody production. In other words, when they do blood serum tests, their serum, the plasma that the red blood cells flow in, are loaded with antibodies
It's crazy.
that a few years ago weren't in there.
Yeah.
So how did we get that? Well, that's the point of the vaccination program. I mean, that's the goal.
Lots
for
of
massive
antibodies.
antibody production. In the debate I had with Dr. Paul Offit of the Philadelphia Children's Hospital, he says that's the crowning point of achievement of vaccinations, to load the body up with antibodies.
And they're turning on us.
And I said to him, Dr. Offit, and this was on national radio, we were debating, and anybody who knows anything about vaccines knows Dr. Paul Offit. I said, Dr. Offit, the problem is we don't have any long-term studies in any of this. We don't have any long-term studies to assess if a vaccinated child is healthier than an unvaccinated or vice versa over a period of 20, 30, 40 years. Oh, well, we have those. We have those studies. And I said, would you be so kind, and I said this on national radio, be so kind as to send me a study. He sent me a study he did of 14 children over 2 weeks.
Yeah, that was his long-term
That was his
study.
long-term study. And he said we didn't have to go any longer than that because we just had to prove that the body produced antibodies. Well, of course it produces antibodies.
Well, that's a problem.
But at what cost, at what expense, and what kind of antibodies are you chemically forcing the body to manufacture?
Well, we have forced. That's what we've done. We've forced the body to create massive amounts of antibodies. Now, here's the big question. Why did we think there would be no consequences for this?
Yeah, to load the body up with, I've got some.
You've got a good analogy. You got to tell this.
Analogies I want to do, but I want to save my bank analogy for a couple more slides here.
Okay.
So there's this study out of Kobe University in Japan where they took these rats and they put them on a standard American vaccination program, and they wanted to see if they could develop antibodies not unlike autoimmune diseases. And they found that at a certain threshold, which means at a certain amount of these vaccines they were pumping into these animals, they could consistently and reliably get these animals to create an autoimmune disease by simply vaccinating. So this has been done in animals, and then the question, somebody comes along and says, well, they haven't done it in humans, but actually it has, and we call it the last 70 years.
Yeah, we did that.
We have done that. We have constantly, consistently pumped people up with vaccines, and now their bodies are full of antibodies. And what are those antibodies going to do?
Well, autoimmune diseases are the fastest growing area of medical research. And why? They're the fastest growing
subset of diseases.
Yeah.
It's because we are producing them. Where do they all come from? We make these autoimmune diseases.
We made them. Yay!
It's a growth industry. I mean, if people want to invest in something, invest in the growth of autoimmune. Find out the companies that are out there investigating autoimmune drugs and invest in them, because that is going to be one of the growth industries of the future.
Well, there has to be side effects for to do this, and you have a great analogy.
Well, I'm going to do that when we get to when we do a review of the first and second ones. I want those on the screen when we do that.
Okay.
All right. So there's three things to consider here, and we're not telling you to not get a vaccine. We're just telling you, for crying out loud, at least research what you're doing. At least research it. So there's three things to consider. Does the flu shot work?
Yeah, there's a study from the JAMA Journal, the American Medical Association study in 1999, looking at the death rate from infectious diseases since 1940. And what they've found, what's clear, is that the death rate was going way down before the vaccines were introduced. So there's a huge question of whether they work. And the biggest thing is, are they do they last your whole life?
Well, the thing is, you can, when you discuss these things with somebody and that person says, well, look at all the diseases they got rid of, either this person doesn't know history or they're lying.
Yeah.
That's what it comes down to.
They just don't
Because
know.
almost all infectious diseases for which there's a vaccine was almost completely eradicated before the vaccine showed up.
Specifically, polio.
Polio was over 90% eradicated by the time Sabin and the Salk vaccine showed up. But scarlet fever disappeared without a vaccine.
Yeah, we have these charts in our book.
Yeah, in the book, How Vaccines Wreck Human Immunity, we have these charts in there that shows the decline of these infectious diseases before the vaccine showed up.
Yeah.
Well, there wasn't an internet back then where people could, rapidly get some great information on a particular subject like you can today. And don't dismiss something as being unfactual or ridiculous because it's on the internet, because the CDC is on the internet, the FDA is on the internet, the NIH, MedScan, and the other big PubMed.
PubMed, yeah.
Yeah, that has the millions of research articles available on the internet.
Well, the second one is,
You need to realize that these vaccines are loaded with neurotoxins, mercury, formaldehyde, aluminum, and they do work. They do produce antibodies, but at what cost?
at what cost? I'd rather get the flu, thank you very much.
And what about all of these vaccine-damaged children?
Yeah.
Now, I'm not going to sit here and argue whether vaccines cause autism or not, because there's a lot of kids with autism that weren't vaccinated, some of them, but there's an awful lot of kids with autism or that were vaccinated who don't have autism.
I think
That's not the issue here.
Yeah.
The issue is changing the immune system. this is the one that I'm the most concerned about, the changing of the immune system so that the immune system gets confused and doesn't know who the bad guy is, because you get so loaded up with antibodies. What are those antibodies going to do? Again, I want to get to, before I give you the bank analogy,
I'm waiting for
I
this.
need the 1 and 2 back up there again. So what I tell people is, given those questions, I can't tell you whether or not to get a vaccine, but I will tell you to look at it, to think about the potential benefit, knowing that whenever there's an outbreak or an epidemic of whatever it is, whooping cough, measles, whatever, at least half the people who get the disease are already vaccinated. Every time I see an outbreak in our community and you look into it further, you find out most of those kids in the school were vaccinated.
Well, like the measles in Disneyland.
2 years ago, the big 140-some people come down with measles from an original. We found the original person. Well, the original person had a vaccine-altered form of measles, and the overwhelming majority of the rest of the people that got that were vaccinated before they got the measles.
Well, it's because it's not lifelong anyway. And it may not be the same strain as we went into.
It may not be the same strain.
Yeah, we went into that in the last podcast.
Yeah.
A whole lot. So should you
Number
get
1.
the flu vaccine?
Yeah.
You have to think of the potential of any efficacy of the vaccine versus the known risk of injecting yourself or your child with a known neurotoxin and an immune shifting drug.
This is not a question about whether it's going to happen. It does happen.
But it doesn't necessarily rise to the level of other diseases. But you cannot repeatedly vaccinate somebody and not expect a change in their immune system. So given that, you just have to decide which makes more sense to you.
And that's the whole idea behind this podcast, is to give you some basis on to make a clear-cut decision for yourself.
Now, I love this, what Thomas Cowan says. We're quoting Dr. Thomas Cowan through a lot of this, and you read it because this is just beautiful.
Well, it's a very rational decision for somebody to say, quote, yes, I know that giving my child a chickenpox vaccine is going to shift them towards allergies, autoimmune disease, even cancer, those forms of disease. I know it's going to create some neurotoxicity, but I'm not willing to live with the chance of them getting chickenpox.
Fine. What I don't like is, quote, the vaccines work great. There's no downside. I mean, that's a fairy tale.
So as long as people have good information, I think they can make their own decision.
Yeah.
Because I have, most of the juvenile patients that we take care of in our clinic, and we have a mess of them. I just saw 3 or 4 new babies in the last 3 days. Most of the parents are not vaccinating, and
Really?
they're nursing.
Wow.
They're nursing, and they're not vaccinated.
Well, that's wonderful. These kids that are having babies now, because it just kills me. I feel so old at 55, but they're in their 20s. They've never really seen chickenpox. They haven't seen measles. They think these diseases will kill them. And
oh, yes, they run for their lives.
yeah,
Measles,
they're like, oh, no,
measles.
mumps.
You get a rash, you get a little bit of a
Yeah.
fever, and it's over.
I watched a video today from one of those links I had at the beginning, which I don't recommend you do because it's just so horrifying. And this lady had such a horribly vaccine-damaged child. And she said, I was perfect on schedule with everything. And she said, if I had just let my children get the whooping cough, I mean, they're not going to get polio anymore or smallpox, but if I just let them get whooping cough or let them get chickenpox or measles or mumps or all of them, they would have been sick for a little while and then they'd gotten better.
Yes,
my daughter
with
will
lifetime
never,
immunity.
yes, good point. My daughter will never get better.
You cannot bathe a child's brain with mercury or aluminum and
Not have a side effect.
and not have a side effect. And the same thing goes for the flu shot, because the flu shot has mercury in it. And if you're willing to live with the extra risk of getting Alzheimer's, Parkinson's, nervous system disorders, autoimmune diseases, then fine, get the flu shot. And maybe you'll avoid the flu. But I hear stories one after another. Oh, I got sick as a dog after I got my flu shot. But the doctor told me it wasn't from the flu virus. No. It was from the mercury and from the aluminum
That's
and from
right.
the
adjuvant.
polysorbate 80 and all the other stuff
When
that's
they
in there.
say they got so sick they're going to die, people don't say that when they get the flu. They don't say, I was so sick I thought I was going to die. In fact, I was afraid I wouldn't die. I was so sick. They don't say that for the flu. They say, yeah, it was miserable. It was awful. I had a fever. I ached everywhere. They don't say, I thought I was going to die. When would you say you think you're going to die? When you
poisoning.
have or a neurotoxin put in you.
Yes.
That's when you get those kinds of comments that I didn't want to live. I couldn't believe how sick I was. And those are the ones who say, I will never get the flu shot again. So, I mean, I'm telling you that I would rather get the flu. And I'll explain this in just a minute, what happened to me. I want to go through a couple slides here on slide 39 and 40. Give a little credit to Dr. Thomas Cowan because he is an amazing doctor. He's written 2 books. One you need to get, or both of them you need to get. But the one, if you're having a child, is called Nourishing Traditions of Baby. It's not either. It's called The Book of Baby and Child Care. But it's from Nourishing Traditions. The Book of Baby and Child Care. And I would really recommend that. And then his other one that is not just for children is called The Fourfold Path of Healing. So go to his website, fourfoldhealing.com. And that's the 4 is written out, F-O-U-R, fourfoldhealing.com.
Now, I want to bring up again those 2 steps. Number 1, cell-mediated immunity. Number 2, humoral immunity.
Okay. Oh, this is your analogy?
Yes, the cell-mediated is where you run across a new viral or bacterial agent, mold, something that makes you sick. It doesn't make you sick, excuse me. It alerts the white blood cells, the lymphocytes, the T cells, the natural killer cells.
And you get symptoms.
The phagocytes, the macrophages, all the stuff that makes up the cell-mediated immunity. And they make you sick. Your body releases pyrogens that raise the temperature of the body, that activates the white blood cell system, causes an increase in phagocytosis, which is the white blood cells eating the bugs.
And a good, healthy liver will do that.
And it causes something called chemotaxis, which is the chemical movement of the white blood cells through the bloodstream, going after the bad guys. And the side effect of those things, histamine release that causes dilation of the blood vessels to get more lymph in and out of the bloodstream, all these things is what makes you sick. It's not the bug itself. That goes on for a week, 2 weeks maybe, and then you start feeling better. You get your strength back. The watery, itchy eyes are gone. The rash disappears. The sore throat clears up. And now the humoral immunity, H-U-M, humor, U-R-A-L, not E. It's not humorous. It's different than the way you spell humorous, humoral, with an A. Anyway, that takes place by building the antibodies. And what vaccines do is skip the first step and go right to the second step.
Because they don't want you to get sick, or you would never go in and get your vaccine.
Who'd get vaccines if you got sick? Your child screams and cries, look away, don't look at it, don't look at it. Pinpricks over, give them a lollipop or something. And then they go home. But if they got sick from getting the vaccine.
Yeah, they do.
And
but
they
it's
do.
a different kind of sickness. And
Yes.
it's
So here, you go to the
Some never
bank.
get
You got to
over
get
it.
a loan. You want to buy something. You want to buy this real nice fancy car. And you go to the bank, and you got to sit there and prove to the bank why you don't need the money.
yeah.
You know, the collateral, and you go through the credit check, and you go through the job check, and the residence check, and the background check, and and they got to feel you out and make sure everything's perfectly all right before they give you the money. And it's a headache, and it's, I want to get it. I want to get it before they sell it, and there's the urgency and anxiety and all these kinds of things. And then they say, okay, we'll let you know. And then you sit around waiting. And then the second part of the loan is they haven't called you for 2 days or so. You finally call them. Oh, yeah, that loan was, we have your check here. Come and get your check. Oh. And you go in, and there's part 2 of the whole process. Part 1 was the aggravating aspect of the application. Number 2 now is the reward of getting the check. You go buy the car. What vaccines do is you completely bypass the process of application, and you go straight for the money. You come running in with guns blazing. Give me the money. And they give you the money, and you run out.
You got it.
And you got it. You got the money. You got the antibodies.
You cheated the system.
But what price?
At what price?
What price?
Are there going to be any consequences? Well, sometimes no. You might get away with it.
You might get away with it.
But if you do it often enough, you do it over and over
They're
and
gonna
over
catch you.
again, They're going to catch you.
You get vaccines over and over and over again. That stuff is going to build up inside. And this is one of the things that Malcolm Gladwell talks about. I was talking to you about this last night, the tipping point guy.
Yeah.
What's the Blink? He wrote Blink. In fact, we have it downstairs in the
both of
library.
them, yeah.
Is that things build up, and boom, they explode.
Yeah.
Now, you would think, well, duh. That sounds pretty simple enough, but when you look at and read his reasoning behind it, you can see it in politics, you can see it in finances, you can see it in social lives in our neighborhoods and at work, passive-aggressive explosions, things like this. Well, you get the same thing inside your body. You put enough poison in that body, it will get to the point where it just can't handle it anymore.
Yeah, we've been looking for that study that said if you get the flu shot 10 years in a row, that you will get Alzheimer's. But I don't know.
Your chances of getting Alzheimer's goes up 800%.
Well, we can't find the study. I don't know if it's been blacked out or...
No. Oh, you've been searching for it?
Yeah, I can't find it. So
I remember reading it, but it was a number of years ago.
Yeah, I don't know. Maybe
I read it on one of the health shows.
They wiped it off the internet. I don't know how they could do that. But
well, here, for those of you looking at the website or the webcast here, we have the hazardous substance fact sheets from government websites. All those different chemicals that are present in a cocktail called a vaccine. Here are the government websites you can go to and read about these things for yourself.
yeah, they say they're terrible. I mean, this is hilarious. They'll put them in our vaccines, and yet on the...
But if you spill it on the floor,
yeah, we have to
call in the hazmat team.
Yeah, that's crazy. I mean, if you spill mercury on the floor in a dental office, you have to call a hazmat team, and yet they'll just inject that right into your blood.
Yeah, I know kids that used to play with that stuff. They would play with it in their hands.
Yeah,
they would put their hands in it. They would play around, and then they ran for Congress.
And here's one. I'm just going to leave that right there. Here's is aluminum safe? Here's a doctor, Dr. Suzanne Humphreys, is explaining on this YouTube, and we don't have time to play it, but I would love you to all go to YouTube and listen to this. This is called The Case Against Aluminum, and you can just go to YouTube and search for Dr. Suzanne Humphreys or maybe aluminum, and she'll come up. I won't even put aluminum in. I won't use aluminum-laden antiperspirants, which makes me sick that that's all they sell everywhere. You have to go
Guys get deodorants.
Guys get some deodorants without aluminum,
but
but there's none for women. And that's, this breast cancer is, I had all those breast lumps, and I used antiperspirant with aluminum in it for years and years and years and years and years. And then when I was 36 years old, bam, all the breast lumps. I don't know if that caused it, but I won't use them now. Why would I put aluminum right into my bloodstream?
Yeah.
Or in my child's bloodstream, more importantly.
Why would you inject it?
Yeah. But
Let alone on an antiperspirant.
We'll inject it into our babies.
But we'll inject it into the babies.
So I recommend you go listen to Dr. Suzanne Humphreys and listen to her case
We just
against
got,
aluminum.
if I can mention it now, I know it's getting long in this podcast, but we just got a question in from a listener wanting to know if it's okay because her daughter's pregnant and her daughter's obstetrician is pushing her to get the flu vaccine while the baby is inside of her. So the baby can develop antibodies to the flu before it's born. If I had 24 hours to think of something more insane than that, I don't think I could come up with it.
Jack, here's
Number one, whatever flu might be out there right now will not be around when the baby's born because there would have been several mutations will have taken place. Number two, the baby is getting mama's antibodies right now. The baby is born with a lot of mommy's antibodies that are active until about the 5th month. Number three, it can't make antibodies until it's at least 12 months old, certainly not in the womb.
Okay,
This is absolutely insane.
Let me tell you why, in my opinion, that they're doing this. Because I was watching all these YouTube videos and websites for these mothers and fathers were just crying about, my baby was perfectly fine at 18 months. He was perfectly fine. He was talking. He was saying all these things. He smiled all the time. He hugged. He loved the camera. And boom, after 18 months, now he doesn't talk. He doesn't laugh. He doesn't even look up. He regressed. He's back in diapers. I mean, just the most horrific things because they can see a comparison. I think they're putting these flu shots and these vaccines in utero, so they don't have a comparison. They don't know their child's just kind of stupid.
When it's born.
They just think that's how my child is. I just didn't get a very healthy child.
That's a very good point.
There's no comparison anymore. They're starting off on behind.
Well, I suggested to this listener, no, don't do that. And number two,
don't do what?
Don't get
the vaccine.
Because that mercury is going to go to the mom's brain and very possibly across the placental barrier into the baby's brain before it's born. And number two, take your doctor a book called Immunology 101. And let him learn how the immune system works. Because he obviously got out of med school not knowing.
Yeah, and it destroys the gut, and and then the baby doesn't have good flora from the mother.
Let's go on here. I'm getting angry.
It just goes on. Okay. So the forbidden answer that we want to get to, this innate ability of the body to defend itself needs to be enhanced and strengthened through better nutrition and better assimilation of that nutrition. Optimal health cannot be obtained without whole food supplementation, which, by the way, has no side effects.
None.
So we feel very confident in recommending whole food supplementation to help you avoid the flu and to help you get better if you do get the flu quickly.
So what do we recommend if you start to, you just want to make sure that you strengthen the immune system as best you can?
Yeah, because we can't say prevent. So we can say it on a podcast, but here we say to ward off cold or flu, just every day, take your 636. That's the healing triad we've talked about so many times. And that's 6 calcium lactates a day, 6 cataplex C, and 3 cataplex F a day.
We go into great detail with that in podcast number 3.
Yeah, it's one of our first ones. And I would also recommend taking Echinacea Premium, 3 of those a day. That's also called the Fountain of Youth pill.
Yes.
It helps with wrinkles, all kinds of things. So that can help prevent the flu or a cold. And then at the first signs of a cold or a flu, add in a very strong herb called antigraphis. We would also recommend you add in Conjuplex, which is a standard process product that's mostly calcium, but it has RNA, Thymex, and vitamins A and C in it in a whole food form. Then Thymex is another incredible product from standard process, a bunch of those a day, and Epimmune Complex.
It greatly activates the T cells,
yeah,
which you need for cell-mediated immunity.
Mm-hmm. And then take some essential oils and other things we have on this slide. And then if the cold or flu persists, then we recommend you up your antigraphis to 6 a day or even 1 every hour. Conjuplex, 2 every hour or every half hour. Thymex, again, up that. Start taking liquid Echinacea Premium, which is much more powerful than the pills. Do chlorophyll complex pearls to cleanse your blood. St. John's wort, we talked about last time how it helps an envelope virus.
Of which flu viruses are.
Our viruses.
It opens up the envelope. Lets the immune system recognize it.
And it also makes you not depressed. No. People use St. John's wort for that, for no depression, to help their depression, I should say. Golden seal tablets or liquid would be even better, but it tastes horrible. And then zinc liver chelate is also another one.
Zinc is absolutely essential for immune response.
Yeah, it activates over 300 enzymes. It's really critical. But if you can't take all of those things, just do immune support with Conjuplex. Conjuplex, we didn't tell last time, we kind of told the story of the Wyoming chiropractor that won a case against the Supreme Court of the state that he was able.
His grandson got very sick at school. The school nurse sent him home.
And the standard of care is antibiotics.
And
he wouldn't do it.
Yeah, the nurse said, don't come back till you're on antibiotics. So the grandfather, the chiropractor, started loading him up with Conjuplex. The very next day, he's back in school. And the school nurse is saying, well, did you get your antibiotics? He says, no, I'm fine. I took the Conjuplex and my symptoms are all gone. I'm fine. I'm not sick anymore. Well, she raises bloody hell and gets the county health people to bring a charge of practicing medicine without a license. This is not medicine, mind you. This is food.
Yeah.
And it causes him all kinds of grief
spent
and money, $300,000 over several years defending himself. They found him guilty of practicing medicine without a license because he was a very famous alternative doctor in his county, and the medical people wanted to get rid of him because he was, taking money because people were going to him instead of the drugs. And it eventually got up to the Wyoming Supreme Court. And I think there's 3 members of the Wyoming Supreme Court, and one of the justices, after they made their decision, had the doctor there was in front of him, and he said, "This entire state owes you the greatest apology. This is one of the greatest miscarriages of justice I have ever seen."
Wow, that was.
And he overturned all the decisions.
Oh, that's wonderful.
Said to hell with it. He said, "This, and your county in particular, owes you the deepest apology for what they have put you through."
Well, this is an incredible product. It has the calcium lactate, which is such an immune-supporting nutrient in your body. We've talked about the calcium wave in the past. We won't get into it now. Take it on an empty stomach if you can. It helps. It works much better. Thymex, of course, is where it stimulates the T cells that help the immune system. RNA, that's the second messenger of the cell, and it teaches the cell how to rebuild itself. And Cataplex AC, which is vitamin A and
that
C.
are absolutely essential for tissue regrowth.
Yeah, and if you can't afford all the others, just get Contraplex. But look what we're giving you, a coupon that's called Lucky Me. You can only use it once, so you might want to buy a few bottles of Contraplex. You get free shipping, and you get 15% off. We rarely do this on a podcast. But
rarely.
I would just want to quickly, I know this has gone over too long, but I did get the flu last spring. I think it was last spring. I talked about it on the podcast when I did. And I was sick as a dog. I started feeling crummy on a Sunday night. I started taking the middle protocol, basically, that we talked about. I woke up sicker the next day. By lunch, I was almost crying. I was aching, fever, runny nose, etc. All kinds of different. I didn't get diarrhea, though. That was weird. But I was very sick. And I just had major excretion of coughing, and I threw up. It was just bad. I continued taking all the supplements every single hour until bedtime. Then I took the products listed on this sheet for sleep, which is a ton. I mean, I'm sorry. This was a lot. I slept like a baby until 1 p.m. the next day, and when I woke up, I was all better.
I remember that.
I was all better. I felt great. I went to work the next day. You would have never known I was crying the day before.
Right.
I was so sick.
So in less than 2 days.
This protocol is not on our website because it would scare people because it's a lot of stuff. So I'm just putting it on the webinar, and I put it here so I could explain it, but we're also including the handout of this if you're brave. But I didn't have time to be sick very long, so it really worked well.
So to recap, it is your choice to get the flu shot or not. Just get informed.
And
We'll still be friends either way. Do whatever you want to do, but please do it from a position of research and knowledge.
yeah, and you need to know that there are things you can do to build your immune system, not just washing your hands and getting the flu shot.
Yes.
Again, I want to remind you guys to join our texting blast. Text the word healthy to 41411, 41411, healthy to 41411.
And you'll receive weekly discounts and special coupons.
And I'm just going to read the disclaimer really fast. The statements that we have made and talked about specific products have not been evaluated by the United States Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease. All information provided or any information contained on or in any product, label, or packaging or this webinar or podcast is for informational purposes only and is not intended as a substitute for advice from your physician or other healthcare professionals. We did it.
This is the longest one ever.
Disclaimer and all.
This is the longest one ever, but it could have been twice as long if we threw everything in there we could have.
Yeah, forward this to your friends and family. Please, please, please tell as many people as you can to to listen to this, to educate it, to go to the websites I recommended. And then if they decide to get the flu shot, that's their choice. But they at least ought to be educated with this forbidden information that nobody knows before they do the vaccinations. So we will see you next week.
Thank you for listening to the Forbidden Doctor podcast. If you are curious about long life energy enzymes or ageless thyroid, you can purchase them without a membership from our website at forbiddendoctor.com or get our enzyme formula from amazon.com by searching the full term Long Life Energy Enzymes. Don't forget to take our obligation-free symptom survey to get a free personalized supplement protocol recommended for you by Dr. Jack, Mary, or one of our qualified nutritionists. Take the survey, get a call from our nutritionist to create a protocol and a patient login, then use that login to see your own personal protocol along with any favorites you've saved from our symptom library. Remember, our website and our clinic are here for you always.